For those joining, please like and subscribe. Now, Britain has one of the worst death tolls on earth, one of the worst death rates on earth, and one of the worst economic consequences of any other country. One of the most catastrophic handlings of the pandemic has had catastrophic consequences. And I'm very, very lucky to have with me these two authors whose new book, Failures of State, really exposes in brutal and pretty grim detail every single step of the way how a disaster was turned into a national catastrophe. So thank you both so much for joining.
Thanks for having us.
Thanks, yeah.
Let's start, shall we, with because what your book does is it obviously, above all else, focuses on what happens as in the aftermath of the virus in Wuhan. First news reports appeared on the 31st of December 2019 as people were out off for their New Year's partying. It seems like a completely different universe, a lost world, the before times, where the front of the Times newspaper, your sister paper, spoke of a wave of optimism for 2020, which obviously is not quite how it panned out. But there's a broader context, and that's austerity. So do you just want to both talk about the context of years of, obviously, the economic prospectus of the government since 2010, the economic programme, and how that left Britain underprepared for what hit it?
Well, we always believed that we had the best pandemic plans in the world. We were quite arrogant about it. We kind of thought that if some sort of terrible, I mean, it was always the number one threat that there would be some sort of pandemic. It's the worst thing that could possibly happen, and we were supposed to be prepared for it. And there's no doubt in the kind of in the years after 9/11 that we were quite prepared for it, and quite a lot of money went into pandemic planning over those years up to around about 2012. And then it kind of fell by the wayside because of, as you mentioned earlier, austerity. Because at the time when they were cutting everything, things that weren't an immediate problem, such as the threat of a pandemic, became second best, and so all the kind of the stockpiles of PPE were dwindling. I mean, it was quite funny when it was actually dragged out. They'd put labels over it, and then they'd up to kind of sell by 2012, and a new label sell by 2014, and then another one actually by the time it came out of the pandemic. And so the money wasn't going into preparing for it, so we didn't have a good infrastructure. But and you may want to get onto this, but there was also an obsession at the time, and then in later years from 2016 onwards, with planning for a no deal Brexit.
So yeah, I mean, go for it. Sorry.
Yeah, and that became the obsession. I mean, not a pandemic. All the emergency planning went into the idea into Brexit emergency planning, because all those years we did think we might pull out without a deal, it might be catastrophic, etc. And so if you then go forward to December, when the virus starts to come into China, this is December 2019, isn't it? And then into January, we're not exactly in the best place to handle a pandemic, although we think we are for some reason.
I mean, as you write about, the preparations for no deal Brexit consumed a huge amount of time and resources, and I mean, George, maybe add a bit on this. If I was to play devil's advocate, often taking the corner of the government, as you both know, but we were overdue a pandemic. Of course, we all know, of course, about the Spanish flu pandemic of 1918, which killed more people than World War I, and clearly we were overdue for a pandemic. But wasn't it more like, was it so unreasonable to believe it would be a flu pandemic, that actually a coronavirus pandemic, not necessarily something people would be expecting. So does that let the government off the hook a bit, that actually it was more rational to expect a flu pandemic, which has a specific approach, rather than a coronavirus pandemic?
Well, I think it was would have been logical to prepare for both. There was the SARS crisis in the early 2000s was incredibly serious, and so it was absolutely clear that therefore it could be flu or coronavirus. So to put all our eggs in the flu basket did seem unwise. But you have to remember that when we actually did our risk assessments of what was the major threat to the country, this was by all the emergency planning experts judged to be the biggest threat to the country, because they could see the implications, what the implications could be, and we've seen that over the past years. It's turned into the biggest crisis the country's seen since the Second World War, and certainly in 2016, when they had their last pandemic practice, cross-government pandemic practice called Exercise Cygnus, it was absolutely clear that we were completely unprepared in terms of our PPE and in terms of the provisions for protecting the elderly in care homes, and the concerns around the ventilators. But of course, that was the same year that we had the Brexit referendum, and the priority went on to no deal Brexit. And we spoke to, for the book, to emergency planners who had been involved in trying to ensure that the government wasn't completely neglecting it over the last few years, and just finding that their meetings were just being bumped for no deal Brexit planning meetings instead. And they talk about talking to doctors and hospitals and things, and discussing the possibility of a pandemic. And one of the experts we spoke to said it was their sweatiest nightmare was the arrival of a pandemic of this type, because they could see how eroded our preparations had become.
Now let's talk about January and February 2020, and obviously now we're a year almost since the lockdown, the national lockdown began. But January and February, because at that point in January, I suppose it began with rumblings in the distance, some thunder in the distance. We know what, within the first couple of weeks, you get the first death, you get confirmation of human-to-human transmission. Clearly, at the end of December, it was a cluster of pneumonia cases, which was unexplained, which was reported to the World Health Organization. But in January, things developed quite quickly, and you get the lockdown, of course, in Wuhan. Stories of people being, literally welded into their homes. And it seemed like this surreal, distant nightmare to lots of people at that time. What was going on in January? What was going on in the government? And what were the sorts of warnings that could have been heeded at that point?
Well, it seemed pretty clear that this was quite serious. And there were kind of many kind of scientists who were actually tweeting at the time to say, oh, this one's serious. Look, maybe it's the big one. We've got to take this seriously. Because it was quite obvious that China didn't cover themselves in glory, because initially they didn't admit that there was human-to-human contact would cause this virus. And it took several days before that happened. But it was obvious that this was happening, because the doctors in the hospitals were getting coronavirus. And then there was this, I don't know if you remember it, that extraordinary scene of all the bulldozers making an emergency hospital in 9 days, which was, something really calamitous was going on. And it it needed urgent action. And they did at the end of January, January the 24th, actually call a COBRA meeting. I think we've written before, of course, the Prime Minister didn't turn up to the COBRA meeting, and Matt Hancock breezed out and said, well, the threat was really low, and there was nothing to worry about. And I think what was going on at the time in the Conservative Party was that if you remember, January, of course, was the big month for them. That was the month they were going to deliver Brexit. At the end of that month, that was it. And that was where all their concentration was. And that certainly was where the leadership's concentration was. And so there wasn't any real thought given to the possibility that this pandemic might suddenly come over here. I think they dismissed the threat to a large extent. And given what we'd said earlier about our poor preparedness, and the fact that we'd allowed all our stockpiles of PPE, etc., to dwindle, and our emergency planning was kind of in abeyance, they needed to hit the ground running at that point, and they didn't. They just kind of watched it steadily. There was very, very little happening. I mean, I seem to remember, George, didn't Matt Hancock once explain to us the few things that he did do in that time? And it was pitiful, wasn't it, I think?
That's right, yeah. They we wrote our first article, the government wrote a 2,000-word blog trying to undermine the reporting, and they tried to, the Department of Health produced a list of all the things which they said they'd done, and actually it was significantly less than we'd actually reported. So it actually kind of undermined their own case.
I mean, on the 22nd of January, at that committee, they heard that Chinese scientists at that point were warning the virus on average would infect another 3 people. So they already knew at that stage it was far more infectious than flu. And yet at the same time, you had, was it 3 weekly direct flights coming in from Wuhan at the time? What does that say? I mean, so they knew, and it's very important to say, isn't it? It wasn't by that point, because I think the problem is it's very easy for those defending the government's record to say benefit of hindsight, but it's important to get the timeline right, as your book so brilliantly does, which is at that point, by January, mid-January, they knew this was extremely infectious. And yeah, and Neil Ferguson at the time was saying that a 60% cut in transmission, Professor Neil Ferguson, of course, transmission rate was needed, which meant the strictest possible measures. So they knew it was very infectious, and they knew very strict measures would be needed in order to deal with it.
That's right, and Professor Neil Ferguson, the results showed that it was more infectious than the Spanish flu in 1918, which had killed up to 100 million people. And so the alarm bells were being rung, really hard by the government. Professor Ferguson was the government's chief modeller at the time, but Matt Hancock came out of that COBRA meeting and said that the risk to the UK was low at that point. But subsequent studies have shown that that thousands of people were allowed to fly in from Wuhan, and even more from hotspot cities in China more broadly. And so, I mean, that just seemed like a very obvious precautionary step to take, is just to cut off flights from the one city where they were building a hospital in 5 days to try and desperately try and provide care for the thousands who were dying of the virus. So I remember at the time it seemed hard to understand what the rationale was for that.
Now, at that point, other European countries were beginning their emergency procurement arrangements, weren't they? That Britain didn't come up with that programme to protect frontline staff till March. What's going on?
Well, you then went into February, and nothing happens in February, as far as I can see, as far as we can see. I mean, when we first started looking at this, in fact, actually, February was how we kind of got into it, because we were asking ourselves, where was the Prime Minister in February? There wasn't an awful lot of evidence of him, and there certainly wasn't an awful lot of evidence of him engaging with the virus. But the one thing he did do was that on the Monday after they delivered Brexit on the Friday, so it was a Monday very early in February, I can't remember, is he gave a speech in Greenwich, and in this speech he talked about how he would don the outfit of Superman, and he would rid the world of this kind of fear of an irrational panic about such things as the coronavirus. he clearly didn't consider it to be a serious problem, and in fact, he thought it was a hindrance and a nuisance, which might get in the way of Britain's new era of free trade after delivering Brexit. And so, I mean, and it falls down from there. That nobody's doing very much at all. I mean, we talked to people within Downing Street who was saying things like, it can't be the big one because nobody's doing anything. It can't be that serious, which was extraordinary. And of course, and then in February, Boris disappeared for a while, and he went off on a holiday for a while. He had quite a lot to attend to. His complicated personal life was catching up on him. I mean, he had several things going on at the time. And so February is kind of like, it's like time holds still in February in terms of the response to the coronavirus.
I mean, that was the month where on Valentine's Day, the first person dies in Europe. And then you get, a outbreak gathers pace in Italy. So again, at that point, because I think people think again, with hindsight, it all congeals together as one. But it was clear in February this had arrived in Europe. You already had deaths and the beginnings of the outbreaks in northern Italy, in which you had localized attempt to suppress the virus. Sorry, George. That's
right, and you compare that to what the Prime Minister was doing. So through February, through the end of January and through February, there were 4 more COBRA meetings, and the Prime Minister's job in this, is to, when the country is facing a massive crisis, the most important job he has is to take it seriously and make sure the country tackles it properly. And his great hero is Winston Churchill, and Winston Churchill's great achievement was that he managed to foresee the threat of Nazism and predicted it, and then acted to quell it. But Boris did the exact opposite, and in those subsequent, the first COBRA meeting we discussed on 24th of January, he was instead he was celebrating Chinese New Year with the Chinese ambassador a few meters away out the front of Downing Street. The next one, he instead attended a Facebook Live event in which he was kind of pontificating about Shakespeare and Elizabeth I. The next one, he posted a jokey video about whether Boris Johnson was for or against Brexit. And on the last one, which was in the middle of February, instead he took a call from the Chinese president, who wanted to thank him for the fact that Britain had given hundreds of thousands of pieces of our PPE kit, which we'd need in just a few weeks desperately. He sent it over to China as a donation. And it then took us a couple of months to buy our donation back. And by then it was too late, because many healthcare workers had died from the virus because they didn't have the right protective kit. So, and what the Downing Street Insider says, that the problem is that you can, even if you try and make efforts to sort of enact our pandemic plans, if the Prime Minister is not engaged and people can see that he's not interested in the issue, then things just don't happen in the same way as they would if he did. And that was the great problem. And then he then came back from his holiday in the final week of February, and again, rather than finally hold a COBRA meeting to address the issues that you could foresee in Italy, the first thing he did when he came back was attend a fundraising ball for the Conservative Party, in which ironically one of the lots that the donors attending the ball could win was a holiday to northern Italy, which is exactly where the pandemic was at its worst in Europe at that point.
I remember, I have to say, the mantra at the time that was kind of popular was, well, in northern Italy, they've got an older population, they kiss each other when they greet, they live at home with their parents, all these self-delusions that were propagated. But by the end of February, you got, the Ireland versus Italy Six Nations matches cancelled. I looked through to torture myself on YouTube the various football matches taking place across Britain at the time, absolute rammed stadiums all the way through. Now, at the beginning of March. This was the whole wash your hands, sing happy birthday. I mean, I have to say, this book is It's painful to read because it's a very near history. But it is a horror film. It's like reading a horror story, which we're currently still suffering the consequences from. But this extraordinary moment when on national television he boasts of shaking hands with COVID patients, he goes on This Morning, he shakes their hands. I know that, the fact he goes to Twickenham in the England versus Wales match, the Cheltenham Festival later cites his presence at that particular game in order to justify them going ahead. I mean, these aren't small things. It's the Prime Minister. And, what he says sets the tone for what everyone does across the country, Cheltenham being one example.
Yeah, and he'd been told quite clearly by his scientists that he had to set an example in terms of shaking hands. And shaking hands was one of the first things that we got rid of. And it was, shaking hands and washing our hands, if you remember at the time, wasn't it? And so that was why we were all doing the kind of nervous kind of elbow bumps at the time. But he kind of totally disregarded it. I mean, we were discussing this earlier with George because we have a prime minister whose hero was the mayor of Jaws, and the reason that the mayor of Jaws is a hero in his eyes is because he refused to shut the beach when the big shark was eating swimmers. And this was regarded as a kind of brave, bold gesture. And I think when I read something this morning from the BBC, a quote saying that he was overheard telling people just to ignore it, i.e. the pandemic, because it was just another of these kind of scares from the East. He really just didn't take it seriously. Even at the beginning of March when he was shaking hands. And then by then, after missing 5 COBRA meetings, he did actually attend the first COBRA meeting in either at the end of February or beginning of March. I can't remember what it was.
Beginning of March. And at that point, by the beginning of March, he attended that first COBRA meeting and they came up with this mitigation strategy, as they described it. But it was effectively a herd immunity strategy. And the extraordinary thing is that by the 2nd of March, again, Professor Ferguson had done the modelling on the results of that strategy and the predictive results, and the outcome was awful. I mean, however they modelled it, they couldn't see a scenario where we'd have less than 200,000 deaths in this country through that wave, and the modelers expected the government to then turn around to them and say, okay, well, can we have a look at what they did in Wuhan, for example? How would a lockdown change the numbers? But they didn't, and they just seemed to be happy to pursue that strategy with the knowledge of that tragic fallout. And so the modelers, and Neil Ferguson and Professor John Edmonds at London School of Hygiene and Tropical Medicine, then took it upon themselves to model a lockdown scenario. And by that second week of March, they were able to present the government with the results, which was that they reckon that there would be around 50,000 deaths, so a quarter of what their herd immunity strategy was predicted to result in. And so that then put a great deal of stress on the government, because if it had emerged that they would have deliberately ignored their advice and pursued a strategy that would have caused 4 times the number of deaths, it would obviously been politically disastrous. But the other crucial thing was that there's a Professor Stephen Riley at Imperial College London, who's also on the government's modelling committee, had also analysed the implications of delaying lockdown. And by the end of that first week of March, he delivered a paper which showed that the herd immunity strategy was completely futile, because even if you just allowed the virus to rip through the population, it would incredibly quickly overwhelm the hospitals. And that meant that if people could see that they wouldn't get the care they needed, they would impose their own lockdown on themselves. And so you wouldn't get you wouldn't achieve the herd immunity you were aiming for, and all that would happen is you would just have more deaths, and you then have to have a longer lockdown because it would take more time to bring infections back under control, and so it would be the worst of all worlds. So the government had been warned of that by the end of that first week of March, yet it still took another 2 weeks for them to bring in the lockdown, which turned out to be the single most important reason why we had the most deaths in Europe and the worst economic fallout in that first wave.
Because if you remember, during that period, what was happening was the mitigation strategy you mentioned. I mean, I remember when we first went back through it, we watched every word the government had said in terms of their press conferences and etc. And it was all about, we will act, we will bring in measures, but we're not going to do it now. We're going to do it sometime in the future. And there was no logic at all for that. If you think about what is the purpose of allowing infections to spread and grow, etc. And what was quite clear, and it became quite clear in that crucial week, I think the second week of March, was that because some government figures actually kind of named it, they said this was a herd immunity strategy, and it was. I mean, they decided to treat it as if it was flu, and the classic way is just to let flu go through the population and infect loads of people, and then eventually, 60% of the population might not be infected, and you'd have a certain immunity in the population. But what was clear from this, and what the scientists were telling them, was that this is not flu. This thing kills people, and your hospitals will soon be absolutely chock-a-block if you do that, and then the whole thing will grind to a halt. That was going on until probably, I think it was March the 14th was the turning point, wasn't it? That Saturday morning meeting in Downing Street.
I mean, on herd immunity, just quick. I mean, I do think there's been extensive gaslighting over whether this ever happened, because of Robert Peston, the ITV political editor, not having to go ahead, but he did obviously write an article based on government briefing about herd immunity. That was the strategy of the British government in minimising the impact of COVID-19, is to allow the virus to pass the entire population so that we acquire herd immunity. That was briefed to him. BBC political editor Laura Kunisberg tweeted out a video which went viral to her 1 million+ followers. Curious, it was a video channel with about 1,000 subscribers. He was a foot specialist, a podiatrist, named Footman 447, and it showed him with some water, and he was using this. He thought he's so clever. He got this jug of water, and then he was trying to explain herd immunity, and if you pour this amount into the water, it was human life. Extraordinary. I mean, I think it's fair to say Lord Kunisberg did not just randomly go on YouTube and find a foot specialist called Footman 447. I think that was presumably given to her by perhaps maybe some influential figures who thought it was a good way of popularizing the government strategy. I mean, that was a huge thing. A lot of the media, this is what I know, there's an omerta, which I don't observe, about journalists not criticizing each other, but systemically, there was a media failing at the time, was there not, to critique exactly what the government was doing. And I was on the show with Caprice on Channel 5 when she suggested to that maybe the Asian-style lockdowns were the way forward, and then she was ridiculed. It wasn't the best moment for the British media, was it?
I mean, to be fair, Owen, that video was actually retweeted by Nadine Dorries, the health minister, who said that this is a great description of our government policy. It wasn't just Laura Kunisberg. It was the actual government minister was.
It went viral. It got millions of views.
Yeah, and I mean the extraordinary thing about that was that Nadine Dorries retweeted that shortly after Matt Hancock had written in the newspapers that the government was not pursuing a herd immunity policy, and it had never been its intention. But he obviously hadn't got the message to his health minister in time.
Now, in terms of the themes of what the government got wrong, I mean, there's been this, suggestion which has been popularised by some commentators that Boris Johnson is just a raging libertarian who, in his attachment to ancient liberties and the God-given right to go to the pub, just couldn't bring upon himself to impose these levels of restrictions. I mean, in the week in which the policing bill, which could potentially suspend any protest in the country, this seems a little difficult to stomach. But do you not think the problem was, and this is where later Rishi Sunak comes in, is there was a false dichotomy between public health and economy, that the impact, I know behavioural science perhaps had a role. I'd be interested to hear what you think about that, where some behavioural scientists were like, there was no way the public will acquiesce to this level of restrictions for a protracted period of time. But there was a sense that this would be so catastrophic to the economy that it was beyond even countenancing a protracted lockdown, when actually, clearly a public health crisis is an economic crisis. The threat to the economy is the virus. If you clamp down on the virus, then you'll have less of an economic impact. But that wasn't the constant running calculation they were making, including in the run-up to the 23rd of March, which now Boris Johnson is briefing that he regrets not moving faster on.
Yeah, and that was exactly what Professor Stephen Riley was the first to vocalise. In that paper in early March, he summed it up and pointed out that the more you allow infections to spread, the longer the lockdown ultimately has to be, and therefore the worst economic fallout. It's a very simple logic. You could probably teach a child, frankly. But obviously, in the short term, if you lock down early, in the very short term, in the next few weeks, you will suffer, a worse economic hit than you would if you kept society open. But it was incredibly short-termist view, and obviously the other catastrophic fallout of not bringing in the lockdown is you allow many people to die unnecessarily, and that is the single most important truth of the pandemic. And countries that have had a fraction of our death toll and a fraction of our economic hit had leaders who appreciated that in March, and you can see that around the world, and in Australasia, in Asia, and also in Scandinavia, and it's a lesson that was learned by our own the scientists on SAGE, and also Michael Gove and Matt Hancock, even Dominic Cummings, who I understand initially had been interested in the herd immunity approach in February and early March, but he, by the 14th of March, had recognised, as Stephen Riley had, that this was going to leave us in the worst of all worlds. And but despite that, Boris Johnson and Rishi Sunak seem to have never learned it, and we ended up. I mean, we started writing the book in early summer, and we assumed that we'd be writing about the catastrophic consequences of one late lockdown, but we ended up remarkably with three.
And before I ask you about, because we're talking about March, September, and December essentially, but masks and PPE. Should you want to just touch on what you found in terms of PPE and care homes? Of course, can't forget care homes, the calamity of care homes. So 3 big disasters. I think care homes, the seeding of the virus in one of the most vulnerable sectors imaginable, PPE and masks. Just what some of your most striking findings about all 3.
Well, with care homes, I mean, they shoved loads of people out of hospitals into care homes, and including people that they knew had the virus, so that they would actually be cared for in the care homes. And they were putting people with the virus into the most dangerous place they could possibly be for the other residents. And then what happened in care homes is that the care homes, once people became infected, they were just not going to hospitals. And so it was an absolute disaster, because allied to that, as you were saying, as you were kind of hinting at, I mean, there was insufficient PPE for any of the care home workers, and so I mean, there wasn't enough in the hospitals. I mean, the hospital, there were kind of. Do you remember those pictures of hospital staff who had to wear bin bags instead of gowns because that's all there was, and there just wasn't enough there. And as a result, the carnage in the care homes was appalling.
By June, 1 in every 14 care home residents were killed by the pandemic.
That's extraordinary, isn't it? I mean, I've got a care home at the back of my house, and I would see the ambulances coming throughout lockdown to pick up people, and I think 4 or 5 people died there.
I mean, George, what do you, in terms of, you got that scramble obviously for PPE after the earlier disasters, and then you kept having these delayed, decisions about masks. You got Sadiq Khan saying, "Why aren't we doing masks?" Grant Shapps goes on TV and starts I mean, what do you think the most striking things there?
I mean, it seems clear that their advice on masks. That I mean, I remember my mother-in-law's from Asia, and so she was living with us at the time, and so. And they all wear masks fairly routinely there. And so she got me a mask in early March, which I was wearing on the tube. But the government was sending out the message that only people who are have been advised to have a mask, because they've either confirmed to have the virus, should wear them. Otherwise it was actually counterproductive. But I mean, it's just common sense that having a mask that stops, droplets coming into your mouth and nose was going to, protect yourself. And also, if you happen to have the virus unknowingly, having that around your mouth is clearly going to stop other people catching it. I mean, and so I sat on that tube, and I remember people were kind of backing away from me, and it made me feel like almost like a kind of pariah. And it seems clear to us that was motivated by the lack of masks available, and they wanted to keep them for healthcare workers. Now that is completely understandable, but not to be upfront and honest about that, and to tell us that actually it's counterproductive. I mean, maybe they meant that, but and maybe they genuinely believed it, but they've clearly acknowledged that was completely misguided since then.
Yeah, there was a whole fireside chat, wasn't there, between Dr. Jenny Harris, the Deputy Chief Medical Officer, and Boris, in which he was phoning her up to say things about masks, and she was explaining with masks that, you shouldn't wear a mask unless a medical person had advised you to do so, because you kind of take them off, they get wet and all sorts of things. I mean, and in the end, I think they did admit really that their policy on masks was expedient, if they'd actually said it is wise to wear a mask, then you would have had the little cottage industry of people making masks that did later happen during the lockdown. If you remember, everyone was, you could download your pattern from the internet and get your sewing machine out of your own sewing machine.
Now, Rishi Sunak is one of the most popular politicians in the country, and yet there's a very strong case to suggest he's one of the major villains of the piece. I mean, obviously, what you get after the first wave is you get during summer, because of the success of lockdown, cases come down, deaths come down. We're down to about 8 to 10 deaths a day during that period. This kind of the COVID lull. But in this period, you get Eat Out to Help Out, which was then linked to 1 in 6 COVID clusters over the summer. But you got as well in this whole period, we didn't have a functioning test and trace system. We ended up with the front page of the Telegraph, go back to work or risk losing your jobs. You got the University and College Union releasing a statement entitled "Universities must not become the care homes of a COVID second wave," warning of the consequence of the migration of 1 million students traveling from every part of the country to every other part of the country. Who would have thought? And then, in September, you do get COVID begins to roar back. And on the 21st, Sage calls for a circuit breaker lockdown, warns of catastrophe. Vallance and Whitty publicly warn of 200 deaths a day within a month, which is vindicated despite the mocking of people at the time. But actually, Boris Johnson at the time was umming and ahhing, and the man who led the offensive against a lockdown was Rishi Sunak, and he brought in lockdown deniers to the heart of power to make the case against, and they won. Now, I mean, this is a big moment, isn't it?
Yeah, I mean, obviously Rishi Sunak saw it his job as to try and kind of reignite the economy. But I mean, the World Bank had done a study of all the successful nations in COVID, and they quite clearly shown that the only way your economy could thrive in a pandemic of this nature was you had to get cases right down to really, really low levels, and that would allow you kind of space for your economy to thrive. If you allow the cases to grow, then it's just going to lead to a longer lockdown and even more economic damage, as well as, of course, killing a lot of people. And we don't really understand, because if you imagine that they got the first wave wrong, and people could say, well, Boris would say, we're looking at it with our retrospectrogram, and it was a novel thing. And what happened at the first wave was that he did decide to lock down around about the 14th. Then he kind of dithered about it, and in between the 14th and 23rd, because the virus was spreading so fast, it was doubling every 3 days. It went up from 200,000 to 1.5 million. And when he'd come out of lockdown in April, do you remember? Of course, Boris was in hospital. When he came out of the hospital, he'd actually gave a speech in which he said, the only way that we can prosper as an economy is if we keep the R below 1. And so he knew quite clearly that it was important to keep R below 1. But then this seems to have all gone out of the window, and a lot of this seems to have been inspired by Rishi Sunak, who is very much the architect of Eat Out to Help Out. He was the Treasury were cheerleading Super Saturday or Independence Day on July the 4th, if you remember, which was the day when all the pubs opened. And it's quite interestingly, that day is the very day that we got to the lowest number of COVID cases we've had, which was 600. And from that moment on, it rose through July, August. So that when you got to that point in September, you had figures such as Cummings, Gove, and Hancock saying, we've got to have a circuit breaker lockdown because the cases are just shooting up, and then you've got schools coming back, you've got universities coming back, and all of those sort of things. And Boris seems to agree, and then it's Sunak who has a meeting with him on the Friday evening, and they decide then to put the circuit breaker on hold, because we know from working in the media that the newspapers that weekend were planning to go that weekend with stories saying there's going to be a circuit breaker, and then they kind of cancelled, and those stories were stopped either Friday night or Saturday morning, and so as a result of that, they have this meeting at Downing Street on the Sunday evening, in which they bring these kind of people who have been strong proponents of a policy in which the elderly, the sick are protected, and the virus is allowed to run riot in the population, and that's the decision that's taken. And what's extraordinary about that is that's whatever it was, 21st of September, and they allow the infections to keep growing and growing and growing through the weeks in October. And in fact, Rishi Sunak actually gave a speech, didn't he, in which he said that we should only act with a lockdown once hospitals were near to being overwhelmed. And that's really, I mean, he's a very, very bright man, is Rishi Sunak, and it's very, very hard to understand his logic. so you allow the infection to spread and spread and spread, and then you're going to have a really long lockdown because you've so many cases. And the result of that is not only, I mean, we've had an awful second wave death rate. I mean, I think we had 55,000 people died in the first wave, didn't we? And now I think if you look at the ONS figures, it's around about 145,000 now. So that's almost 90,000 people in the second wave, which had they kind of acted quickly to nip it in the bud in September, we don't know absolutely what would have happened, but I think most people would agree that far fewer people would have died, and our economy would have not suffered as badly as it has. Because I mean, our economy is obviously suffering desperately now because we've had a lockdown almost throughout the whole winter.
I mean, before I asked you about what happened at Christmas, and it is even if you go by the official, because obviously you've got excess deaths, you've got COVID on the death certificates, you've got, I mean, there's different ways of measuring what the scale of the calamity, all of which are terrible. But even, the official death toll, half have died since the 8th of December, which was 3 months ago. But in terms of the borders, what the hell happened? I mean, it's astonishing. I mean, you could argue earlier on, well, Britons are stranded abroad. Get them back urgently. Close the border. What? No testing at airports. What were they thinking?
I mean, we in our book we compare our policy on that to New Zealand's, where Jacinda Ardern acted quickly, and you can see they had their first lockdown in the first wave in beginning of last year, but because they probably control their borders, they've all been living normal lives for 9 months or so, and their economy has been recovering far quicker than ours. So, I mean, it is extraordinary. I mean, they finally come around to this idea of hotel quarantine, almost a year late, and it's just absolutely symbolic of their failure to learn lessons. And that's, I mean, we were speaking a lot to the Brie families, who we tell quite a few of their stories in the book, and they wanted an inquiry in the summer to force the government to learn these lessons, to try and ensure that there wasn't a significant second wave and people didn't die unnecessarily like their relatives had. And Boris Johnson and Matt Hancock refused to even meet with them, let alone hold an inquiry. And when the Brie families then wanted to bring a judicial review to try and force the government to hold an inquiry, but the government refused to say that they wouldn't charge the families their costs if they lost their case, and that meant that the Brie families could end up potentially bankrupt if and have to pay their money to the government's lawyers, which just seems morally bankrupt, frankly. And so they've since had to fundraise to try and raise enough money to be able to bring the case, and that's why it's taken this long. And unfortunately, in the meantime, as you said, Owen, the majority of the deaths from this pandemic have occurred.
So just before I ask go on. Sorry, don't go, Jonathan.
Sorry, I was just going to say, although at the beginning, Boris seemed a bit confused as to whether we were stopping people in the border. There was this extraordinary video of him visiting the public health laboratories in Colindale in March, or was it end of February? It's around about then. And he's asking the people there, and he's saying, how does it work when they come through airports? And of course we test all those people coming in from airports. And they say, promise that, no, that's not our policy. But he didn't seem to know.
Astonishing. I mean, just before I ask a final couple of questions, December then. I mean, and as I've said, we got a tidal wave then of COVID deaths, horrific. When we got, you got push notifications of 1,800 people reported dead in a 24-hour period each day. I mean, by January, it was, a horrific situation. And if you go by excess deaths, the peak was smaller but more protracted than the first wave. So, however you measure it, a disaster. What happened? How do you interpret what happened at Christmas?
Well, in July, Sir Patrick Vallance, the chief scientific officer, commissioned a worst case scenario report for the winter to try and allow the country and the government to prepare for what might happen. And that report had said that if we allow infections to increase again, then the risk of a mutation to the virus, which will make it more dangerous, significantly increases. But as we just discussed, Boris Johnson and Sunak ignored that warning, and sure enough, by December it was clear that we had a far more infectious mutation. And to compound that, they'd lifted the lockdown at the beginning of December when we still had 16,000 cases a day, which is vastly higher than the 600 a day that when we'd lifted the first lockdown, and the consequences were absolutely disastrous. One of the most extraordinary statistics that we discovered when researching the book was that at the point of first lockdown, there were less than 7,000 COVID patients in hospital. At the point of the second lockdown, there were around 14,000 people in hospital. And by the third lockdown, January the 4th, there were 30,000 COVID patients in hospital. So Boris Johnson's prevarication was growing exponentially, just like the virus. And he wasn't just not learning his lesson, he was actually getting worse. And the consequences in January were just absolutely appalling. I mean, it's absolutely clear that thousands of COVID patients died without getting the life-saving care they needed, because there just wasn't enough intensive care beds or staff to cover it. And certainly in the first wave, the government claimed that everybody had got the care they needed, but the evidence for that in both their own statistics and from the testimony of doctors and nurses is complete nonsense. But they not only allowed that appalling scenario where, we're in a developed country, yet there been 3 occasions in the last year where if you got ill, you could not be sure to get the best care you needed. And that's I had to tell my mum and dad and granny that you can't go out because you can't take any risk, because this is the only time in your whole lifetime that you might not get an intensive care bed. And it's just appalling that was allowed to happen.
Couple of last cheeky questions. Methodology. So when I studied history, we were always told when you're dealing with particularly a disaster, you have to manage the fact that lots of people engage in self-justification and try and point the finger at everybody else in order to absolve themselves of responsibility. And clearly in a, the biggest peacetime disaster of modern times, there is an incentive to do that. So you might have, Michael Gove trying to present himself in one particular light as being a voice of reason. How do you deal with that? How did you deal with the fact that many sources may tend towards trying to perhaps portray themselves as being more sage than maybe they were at the time?
Are you going to take it, George, or will I take it?
Either. Sorry, yeah, go for it. Sorry, left it.
It's funny enough. Many of the people we talked to didn't feel the need to self-justify. They were just straightforwardly critical, to be fair. And I think that the government does fear an inquiry, and which is why we're not having an inquiry at the moment, because it will be quite damning of the government. And when you talk about people, someone like Michael Gove, for example, he did seem to get the point at the end. He wrote this long piece for the Times. It was like a personal piece in which he explained the logic of lockdowns, which was exactly the right logic, which was that you had to hit it hard and quickly, and that way you'd protect both lives and the economy. But that doesn't seem to. There seems to have been a bit of a split within the government over that. and it's kind of, and obviously we don't always know who's arguing what within, but there do seem to, by that stage, there seems to be two camps, and they are on one side, and the Chancellor and Boris seem to be on the other side,
and you're right, Owen. I mean, obviously people will try and pretend maybe, or re-engineer history to try and make it sound like they called it right at the time. But certainly in our book, we made every effort to try and gather evidence that what people were claiming they did at the time, that they could actually evidence that. Could they show any kind of record that they had actually issued a warning or expressed their view on something at that moment, rather than just asserting they had. And so that was one of the big kind of due diligence processes we went through as we did the research for the book.
Finally, I think this book is one of the most important books written for a very long time. I think it's a masterpiece, and I also think it performs a very, very important democratic service, because I do think most of the media failed in their responsibilities. I think the official opposition has failed very badly in their responsibilities as well. We have the worst death rate, I'm looking here, currently, other than Slovenia, Belgium, and Czechia on the face of the earth. San Marino is too tiny to make any comparison with, but those other countries are very small. So of a major country, no country is as badly hit as Britain has been by the worst catastrophe since the guns fell silent in 1945. And yet, I suppose what I'm wondering is, are you urinating into a strong gust? They've got away with it. Mass vaccination has been a tremendous success, partly because, unlike test and trace, they haven't handed it to private contractors, and public bodies have done a very good job. Our National Health Service has done a very good job. And because of the failure, for example, of the official opposition to pin responsibility on the government, people are just going to be relieved. What's Boris Johnson good at? He's good at sunshine and optimism. And he will ride as Britain becomes, as the days get lighter and sunnier and longer, and Britain becomes freer, people will just want to breathe a sigh of relief. Thank God this nightmare is over. And because lots of the media have they've done these shots of parks which looked busy, but actually, if you actually go to the parks, you see people are socially distanced. But a camera at the right angle gives the wrong impression. Lots of people ended up blaming the public. They think it was a failure of individual responsibility rather than a systemic failing by those who rule over us to do their one most important task of any democratic government, which is to safeguard the security and safety of their own people. And therefore, as unbelievably important this book is, and everyone needs to read this book, they've got away with it. And this book will be for those of us who know how important this book is. This is extremely important, as I say. But for those reasons, the government have got away with it. What do you think?
Well, I mean, I think it's our job is to try and present the truthful account of what happened during the pandemic, and I think you're right. I think the media could have definitely done better in being clear about the implications of the government's actions and how avoidable so much of the death, economic damage, kids being out of school, that didn't need to happen. I mean, if you act quickly, you look at countries around the world, their kids haven't been out of school for anything like the same length of time. I think there's a kind of feeling that this was inevitable, and they did their best, and maybe they did do their best, but it's a pretty poor best if it is. And so that's the aim of the book is just to present what we believe is the true implications of Boris Johnson's actions, and then it's up to the public, to take the view. I mean, they have done well on the vaccine rollout. That's true, but whether that will mean that we don't end up with the most deaths in Europe and the worst economic fallout of any G7 nation, who knows? But it doesn't. We're so far ahead on those dire measures that it would take. It would be quite a significant thing. The vaccine rollout would really have to make a big difference for that to be an outcome. So let's see. But all we can do is put out the truthful account, and then people can make up their own mind.
Because of course there will be another pandemic like this. It's this is not going to be a unique event. There'll be another one soon. It's worth learning these lessons to work out how we do. I mean, George talked about the government doing the best they could, but it kind of seems to us inexcusable that okay, so you got the first lockdown wrong, but to make that mistake again the second time, and then to make it the third time, and leave the country in the worst of all worlds, with the most deaths and worst hit economy, is a massive failing. And there's no, the vaccine has been handled really well, and ironically, that's one of the fruits of Brexit. But it does not absolve the government from blame for what has happened over the last year, which has been a very, very poor reaction to what is a novel problem, but it could have been handled so much better.
Jonathan, George, thank you so much. And everyone really does need to read this book, Failures of State. It is one of the most important books written of our time, and it really does expose in brutal detail, and yet so readable, how an inevitable disaster was turned into an avoidable catastrophe, which has killed tens of thousands of people, many people's relatives, my own amongst them. And it's so important to hold the government to account for what they've done. And also, as you know, this won't be the last pandemic. And if any good comes out of what we've just gone through, at least some lessons can be learned to avoid this country having to endure the unprecedented nightmare that we've all gone through. So thank you so much, both of you, for joining, and thank you for writing such a critically important book.
Thank you.
Thanks, that was very kind of you.